Thank you for joining us for a press briefing. My name is Kelly Chandler, the Public Health Division Manager for Itasca County. We're hosting a press briefing today to discuss what we know in Itasca County after addressing a global pandemic for the past 18 months. We have representatives from our three healthcare systems to share what they know and have learned from the pandemic response. Your community members, including healthcare, schools, pharmacies, and public health, continue working together to keep our Itasca families and neighbors healthy. Very excitedly, we have effective vaccines available to keep our friends and neighbors healthy. The Pfizer vaccine did receive full FDA approval for ages 16 and older. We are waiting approval of vaccines for ages 5 and older, and hopefully that will be coming in the next month. Because of vaccines, we've been able to travel without quarantining to places such as Canada and Alaska. Our children have been able to return to in-person learning. Businesses have been open at larger capacities, and our facilities have been open for visitors. Our loved ones in long-term care facilities can gather for meals and activities. And for all these reasons, we're so thankful for our vaccines. We are hearing narratives such as that vaccines don't work because there are breakthrough cases of COVID. And that's true. It's correct. There are some breakthrough cases. However, our data still shows that less than 1% of our fully vaccinated Itascans have tested positive for COVID. And of those who do have a breakthrough case, there is very low levels of hospitalizations, low ICU stays, and deaths. Every little bit will help our healthcare systems who are overwhelmed. And the numbers are really clear. Out of 21,903 Itasca residents fully vaccinated, 0.86% have tested positive. Vaccine effectiveness during trials was around 95% in reducing severe illness, hospitalization, and death. At less than 1%, our numbers of vaccine efficacy is even better than the studies initially showed. And of course, we do know that this could change, but we're pleased with how the vaccines are working so far. For those of you who are listening who maybe are still uncertain about getting vaccines, or maybe you were skeptical or even vocally opposed in the beginning, we do want you to know it's so okay for you to change your mind and make a different decision. We have Itasca residents coming in now who weren't certain about vaccines at first, and really for various reasons. But there is no judgment if you change your mind. Once you have more information, it is very natural to make a different decision. Our clinics, pharmacies, and us in public health are more than happy to assist in getting you and your family vaccinated, regardless of anything you might have thought previously. In regards to our schools, it is so important to keep COVID and illnesses down, and that parents keep your kids home if they are showing any symptoms, even if they're mild. Symptoms that we're hearing right now include runny nose, nasal congestion, cough, sore throat, and of course, there's still the loss of taste and smell. But really, it will take all of us to keep our schools in person. We understand that these symptoms can mimic other respiratory conditions, and it makes testing so much more important to make sure we know what the cause of it is. Testing is available at clinics, Walgreens. There's saliva testing at home through Vault Health. There's some over-the-counter options pending availability that have been available at Walgreens and Walmart. Rapid tests are not readily available. However, the PCR tests are coming back already within 48 to 72 hours. We understand it's not considered rapid, and we're all growing so impatient with COVID, but it is important to continue offering ourselves, our school staff, and our healthcare teams grace, patience, and to just stay at home if you or a family member are ill or pending a test or showing any type of symptoms. We are so grateful to have testing options available today, because we know early in the pandemic, there were not tests available to the general public. To get back to our data and numbers, we acknowledge it can be confusing when numbers are disseminated from the federal, from the state groups, and from us and local sources. We do analyze and review the Itasca data multiple times per week. We're talking with our healthcare teams and our schools at least weekly, if not more, to understand what we are experiencing locally and in our county and our region. And we're so thankful to know our local team members and have relationships already established. We're able to discuss what's going on. We're able to respond quickly to whatever we might be facing. And these partnerships will serve us well during and well beyond the COVID pandemic. The Delta variant is present in Itasca County, and please know that viruses can't mutate if they don't have a host. It is in all of our best interest to take preventative measures to slow the spread of COVID, including masking, regardless of your vaccination status, staying 6 feet apart from others, and staying home when you're sick. For a situational update, we have identified 118 new positive cases of COVID in the past 7 days, 197 in the past 14. Our 14-day case rate per 10,000 as of September 13th is at 44.1. Over 50% of our Itasca residents, regardless of their age, have been vaccinated. 60% of our 16 and older have been vaccinated, and over 1 in 3 of our 12 to 17-year-old children have been vaccinated for COVID. Thank you for doing your part to slow the spread of COVID and for getting vaccinated if you are eligible. We appreciate every little bit you're doing to help us and help our healthcare teams and help keep our kids in school. We'll now move to our panelist portion of the briefing. Our panelists include Sam Dwyer, inpatient pharmacist, Essentia Deer River, Dr. Katy Johnson, OBGYN, Grand Itasca Clinic and Hospital, Dr. Dan Suler, family practice physician, Grand Itasca Clinic and Hospital, and Kayla Scribner, Chief Operating Officer of Scenic Rivers Healthcare. We will now hear from Sam Dwyer, inpatient pharmacist, Essentia Deer River.
Hello, everyone, and thank you, Kelly, for the great information and introduction that you provided. As you said, my name is Sam. I'm a pharmacist at the Essentia Health Deer River Hospital. Thank you for attending the press conference today. I just wanted to add a note that through the FDA approval process, that the safety and efficacy of our vaccines have been very well established. And knowing that our full FDA approval has went through a very rigorous process with millions of patients to be able to collect information on, we've continued to see from reliable sources of information from the Food and Drug Administration, our Academy of Immunization Practices, that the FDA approval of the vaccine has been very well vetted and is in the best interest of our patients. I also want to add a note that Kelly touched on earlier, that for the ages of 5 to 11, that we expect to see an FDA approval coming within the next couple of months. And I know there is certainly interest in having this vaccine group, this population vaccinated, because we want to keep our kids in school and keep everyone safe and healthy. But just please give the time that's necessary for our Food and Drug Administration to review all the data required to make sure that's a safe choice for our little ones. Just a note, in the Deer River area, we are seeing new cases of COVID-19, mostly in the unvaccinated group. And yes, we do still see cases in the vaccinated group, but we have seen a consistent trend that our hospitalized patients tend to be unvaccinated. And the breakthrough cases that do happen in a vaccinated group do tend to be more mild and self-limiting without requiring hospitalization. We also want to note that Essentia Health and Deer River, that we are here for you. And if you are interested in seeking vaccination, if you have not been vaccinated yet, that we will be happy to take you anytime to be able to provide that vaccination for you. Thank you.
Thanks, Sam. And we will now hear from Dr. Katy Johnson, OBGYN, Grand Itasca Clinic and Hospital.
Hi, thank you. I'm Dr. Katy Johnson, OBGYN at Grand Itasca, and I'm very excited to be here today to talk about the COVID vaccine. I spend about 2 hours of my clinic days now talking about the COVID vaccine with women who are pregnant. So I know that this is an area of interest and many women have a lot of questions. As a pregnant woman, you feel fully responsible for this tiny little human that's growing inside of you, and you want to make sure that you're making the right choice for both yourself and your new baby. The data that we have now has shown that the COVID vaccine is safe in pregnancy. And it's also safe for women who are wanting to get pregnant or are breastfeeding. The American College of Obstetrician and Gynecologists,
and Kelly said a lot of the points I was.
The Society for Maternal Fetal Medicine and the American Society for Reproductive Medicine are all recommending that women get pregnant regardless of their pregnancy status, whether or not they're breastfeeding or their future fertility plans. And that's because the data shows that it is safe and it's important. We know that women who are pregnant who get COVID are at higher risk for serious complications, including hospitalizations, ICU admissions, invasive ventilation, and even death. And these are young women that should not be dying from COVID, but we know that pregnancy is that independent risk factor that can make them really sick. We also know that there's risks to unborn babies if you do get COVID when you're pregnant, especially if you get really sick, including pregnancy loss and preterm birth. Here at Grand Itasca, we are offering the Pfizer vaccine basically at any point in time. And we also, the department of our 3 OBGYNs are all very happy to talk to anyone who's got individual concerns or has questions about their health and whether or not they should be getting the COVID vaccine or whether or not there's something extra that they should be thinking about. Thank you.
Thank you. And we will now hear from Dr. Dan Suler, family practice physician, Grand Itasca Clinic and Hospital.
Good morning, Kelly, and thanks for inviting me to this panel. So I just want to touch on a few items that Kelly mentioned earlier. What we do know is in Itasca County, the Delta variant is here. We get asked that all the time, and it is here. One of the unique things we are seeing with the Delta variant is when one person in the family gets infected with COVID, we are now seeing the entire family test positive. And so it is very spreadable, and it's fueling our concerns about especially the school age kids having entire classrooms get infected at the same time. Speaking of school age kids, it is a tough time of year. A lot of kids have viral illnesses, they have allergies, and unfortunately those symptoms are very similar to COVID symptoms. So we continue to stress the importance of keeping kiddos at home when they do have these symptoms, the importance of testing, because unfortunately without testing, we really can't distinguish COVID from other viral illnesses or allergies that we typically see in the fall and winter. And as Sam mentioned, we are anxiously awaiting for the 5 to 12-year-old age group to be approved to get this vaccine in the very near future. I do want to touch on a bit of how healthcare has changed through this pandemic. The way we deliver healthcare has changed, and it doesn't make any of us feel good in healthcare. We are treating patients differently than we have in the past. For example, ICU beds in the entire state are generally full. In the past, that was not an issue for us. If you needed dialysis, you got your dialysis, and now people are having to wait for that. So every time we can keep even one COVID patient out of the hospital, that opens up our resources for our grandmas, our family members who may need hospitalization or ICU level care. So it's all the more important reason to continue to stress our mitigation strategies, which yes, include masking, includes vaccinations. Again, if we can keep just one person out of the hospital, that opens that bed up for somebody else that needs medical care. And I just wanted to finish with thanking those that have been vaccinated. Despite what we hear often, the vast majority of Minnesotans and Itasca County residents have been vaccinated, so thank you. As Dr. Johnson mentioned, it is actually a fun part of our day as physicians discussing vaccinations because we have science behind us. There's not a lot I do in medicine that is 99% effective. And so please, if you are hesitant, if you have concerns, reach out to your primary care provider. We're happy to have those conversations. Thanks, Kelly.
Thank you. And we will now hear from Kayla Scrivener, Chief Operating Officer of Scenic Rivers Healthcare.
Good morning. Thank you, Kelly. What we know today that's happening in northern Itasca County and some of our more rural communities is, like Dr. Suler said, the Delta variant is here. And I just want to start by our heartfelt thank you to the community here in the Big Fork area, the school staff, the teachers, the parents, the students, everyone that's working in healthcare, our physicians, nurses, providers, and everyone that is really pulling together right now to try to beat the outbreak that we're experiencing in our community. So thank you for continuing to be vigilant and take care of each other. So what we also know is that, like Dr. Suler said, we're seeing in our community that Delta is just so much more contagious. We are seeing entire households and extended family get sick. When one person is sick, certainly people that are in social circles or on sports teams together or things like that. It's just, it's very, very contagious, and it's impacting our school system and our healthcare system, because in a community like ours where we are small and close and tight, there are people that overlap those systems. And so we're all doing the best we can, but it has been a challenge for our clinics to keep up with the demand right now. We are experiencing some staffing shortages and certainly burnout and fatigue among our healthcare workers. And so again, we just really appreciate everyone doing the right thing. I think what we know today is that we have to get back to basics. Everyone is tired of COVID and no one wants to be doing this anymore, but we do know what works. And so we need to get back to those basics. Masking works, the vaccines work really well. They are safe and effective. You need to stay home if you're sick. You need to get tested if you're sick. You need to get tested if you know somebody that you've been with that has been sick. And so we just need to really try to get ahead of the spread of this disease. Social distancing, being mindful about who you're hanging out with, and just really trying to stay vigilant about beating this disease. So Scenic Rivers is continuing with our clinics to be able to offer testing and take care of people. We want to continue to do that. And we are going to be having Pfizer in our clinics starting next week. So right now that is for anyone whose age is 12 and up. It's a safe and effective vaccine, and we're happy to offer it. And we can start scheduling that next week. And then we're looking forward to when our younger groups are going to be eligible for vaccine, because that is going to be one of our best ways out of the pandemic. Thank you.
Thank you, Kayla, and all of our panelists. We will now move to the question and answer portion of our briefing, and we ask our media to put your name and the organization you represent into the chat, and we will ask our panelists to answer any questions you have. And we have our first question from Greg Grell, WDSC TV, and this is directed to Dr. Suler. How surprised are you that the Delta variant has caused such a surge, especially after things seem to be on a positive trend earlier this summer?
Yeah, thanks, Greg. That's a great question. Not at all surprised. This is how evolution works. It's in the virus's best interest to replicate and spread. And the more time, the more opportunity the virus has to infect humans, the more changes that virus will go through to enhance its transmissibility and infectiousness. So this is not at all surprising. Again, the importance of mitigating spread through masking and vaccinations is what we have in our toolbox right now to slow the ability for this virus to continue to mutate. With time and with possibility, these mutations may get to the point where we're back to square one, where vaccines and our treatment options aren't effective anymore. And that's, of course, our biggest worry right now. So not at all surprised. This is in the virus's best interest.
Thank you. And we have Brett Scott, Fox 21. Should residents, regardless of vaccination status, be sticking closer to home as the fall and winter months arrive? And Kayla, did you want to speak to that one? Otherwise, I am more than willing from public health as well.
Yeah, I'm happy to. So with the amount of community transmission that we have right now, I do think it is important to be cautious about what you're doing and how you're spending your time. If you know about how the Delta variant works and how much more contagious it is than the previous types of COVID we've seen, it's probably a good idea to think about, where you're going and, trying to stay outside, especially now while it's still nice. If you're having social gatherings, things like that. We can look to other parts of the country, the way the epi curve works for how things are. It starts in the South and the West, and then it comes up towards the Midwest. And so if we're looking at other parts of the region and how severe cases are there, they are advising things like, keeping social gatherings to a minimum and masking even if you're outside in large groups, just because of how contagious the Delta variant is. I think it's important to keep in mind, specifically for Itasca County and northern Minnesota, our vaccination rates are pretty good, but they're not great. So we're going to continue to have community transmission here until more people are vaccinated. And so, yeah, absolutely, it's smart to be cautious when you're out and about.
Thank you. And we have another question from Greg Grell, WGSE. To any panelists, what are the symptoms of a Delta infection? How do they differ from the pre-Delta COVID-19 symptoms? I will kick this one off and then send it to Sam or Dr. Suler or Dr. Johnson. What we learned from our epidemiologists at the Minnesota Department of Health is the presentation was more headache, sore throat, and runny nose. Versus maybe some of the loss of taste or smell. This is an ongoing discussion that we're having with the Minnesota Department of Health, and we're seeking out more information, particularly for our school nurses who are doing some screenings of their students, making sure that they're not infecting others. Dr. Suler, Dr. Johnson, did either of you want to add to that?
I will just add that that was a great summary, Kelly. You know, the other thing we're seeing with Delta is the time from your exposure to when you develop symptoms is shorter than what we have seen with previous variants. So people are getting sicker quicker. But Kelly summarized the symptoms very well.
We will end this press briefing. Thank you all for joining us.
UPM leads the integration of bio and forest industries. Our constant aim is to produce more with less. That's what Bio4 stands for. Paper is true Bio4 product made of renewable and recyclable raw material. It remains sustainable throughout its whole life cycle. UPM Bio4, beyond fossils.